You're listening to Her Brilliant Health Radio, episode number 33.
She used to deliver babies, but now she delivers exceptional wellness for women. Welcome to Her Brilliant Health Radio, where holistic women's health expert and board-certified OBGYN Dr. Kyrin Dunston shares revolutionary insight from leading experts on what you need to know today to treat the root cause of disease, heal, and create the radiant health you've been searching for.
Hey everybody, it's Dr. Kyrin here for another episode of Her Brilliant Health Radio, where you will learn facts and figures and have tasks and information to help you achieve bountiful, blissful, beautiful, brilliant health. Today, please help me welcome my special guest, Dr. Betsy Greenleaf. We're going to talk about a topic that's probably near and dear to your hearts, and I'll tell you a little bit about Betsy before we get started. But we're going to talk about incontinence because that's something that even young women in their 20s will experience from time to time. And as we get older and we age and our hormones change and we have babies, that problem of incontinence can actually increase significantly, and it's something that's a concern for a lot of women. So we're going to tackle that today. So Dr. Betsy Greenleaf is a double board certified physician with certifications in both female pelvic medicine and reconstructive surgery, as well as obstetrics and gynecology. She's also the nation's first board certified female urogynecologist. She was recently bestowed the honor of Distinguished Fellow by the American College of Osteopathic Obstetrics and Gynecology. She is a board examiner for the American Osteopathic Board of Obstetrics and Gynecology and a national spokesperson for the American Osteopathic Association. Dr. Greenleaf takes an holistic approach to treating her patients. She develops a partnership with her patients as she works closely with them to find appropriate therapies that are mutually agreeable and focuses on helping women with pelvic pain, recurrent urinary tract infections, vaginitis, atrophic vaginitis, prolapse, and urinary incontinence. And in her spare time, she's getting her MBA from Temple University and is launching 2 virtual stores that we'll talk about, the pelvicfloorstore.com and gleafgear.com. Welcome, Dr. Greenleaf.
Thank you very much, Dr. Kyrin. I really, and you know, it's funny, you say all those things out loud, and I'm a pretty humble person, and you say all those things, and I'm like, wow, that actually sounds pretty impressive. I'm like, I guess I've done some things. So.
Yes, it's good to hear that because it's important to remember all the gifts you've been given that can help other people. And I think that it is important. And sometimes we're so in the work that we can forget that other people are thirsting for this information. And there are women listening right now suffering with pelvic floor problems, female gynecologic problems, whether it's pelvic pain or recurrent vaginitis or recurrent UTIs or pelvic prolapse where the bladder and rectum are falling in the uterus, or incontinence. So let's get into it. And I know that you really do have a holistic approach. And so when someone comes to you with urinary incontinence, a woman, what are some of the things that you look at?
You know, it's funny because I'll tell you, the first thing that people come into my door, and I'm busy all day long, and I just want to comment on, everyone thinks they're the only person. Right. And, you know, I don't know why that in today's day and age where we're pretty free with health information and you have the internet, people still are embarrassed about incontinence, and they kind of blow it off as, oh, it's just a part of getting older, or like nobody else has this, I'm the only one, and I'm embarrassed to talk to my doctors about it. So, and I think unfortunately, with the way the health system is now, you know, a lot of doctors are rushed and don't have a lot of time. So if it's not on, you know, if it's not in their specialty, you know, your primary doctor may forget to ask you if this is a problem. So I think the biggest thing when it comes to incontinence is it's very, very common. There's so many people that are suffering from this. Look at the pad companies, Poise and, all these pad companies, they're making bazillions of dollars because it is a common problem. And just because it's a common problem doesn't mean that it's a normal part of aging. It doesn't mean that you have to accept it, that there are so many different treatment options and so many different choices that fit your lifestyle and what you find acceptable, that there are things that can be done for this. So I think, unfortunately, I wish more of the primary care doctors would bring it up in conversation, but they do have a limited amount of time. So, don't be embarrassed, I think is my biggest message, and that if this is something that's concerning you and is affecting your quality of life, then you really need to bring it up to your doctors so that they can either themselves help you or direct you to somebody that can help you with this problem. So
yeah, and I think it's important for everyone to hear that just because it's common or normal, quote unquote, for our society doesn't mean that it's optimal. And just because urinary incontinence is common doesn't mean it's something that you have to suffer with, because there are treatments for it, and a lot of them natural, quick fixes. So you're not alone, and you should feel comfortable talking with your doctor about anything, but although I know that's not necessarily the case. But maybe if we talk about it in a little more detail, you'll feel, if you're listening, like this is a common thing. I know when I was growing up, my best friend and I liked to talk about bodily functions all the time. We would talk about, our periods and pooping and things like that. And one day her brother said to us, you guys with these scatological conversations, and we looked at him. Of course, we had to get a dictionary. We didn't have Google then. Scatological, relating to bodily functions. So, yeah. So that's what makes an OBGYN, is someone who likes to have scatological conversations. So your doctors like talking about pee and poop and stuff like this.
Yeah.
So talking to them about it.
Yeah.
So say I'm a woman, I'm 45 years old, and I come to you and I say, and it's usually the doorknob comment, everything's done. And then you get ready to leave and I go, oh, I didn't mention, but I'm having a problem leaking urine. How do you approach that?
So the first thing is really to get a history and be like, well, what's happening when you're leaking the urine? Because there's different types of incontinence or leakage of urine. Mm-hmm. So we have something called urge incontinence, where the typical person is the gotta go. They did those commercials in the past, where basically all of a sudden you're fine 1 minute and then next minute you're having to make this mad dash to the bathroom because you have to go really badly and you can hardly get there. So that's urge incontinence, and that is more of a problem with muscle spasms of the bladder or some nerve irritation in the pelvis, where stress incontinence is not because, hey, I'm stressed and I'm so busy, but a lot of women are. It's more of the stresses. If you cough, laugh, sneeze, jump up and down, is that causing you to have some leakage? So basically, from the first thing is just the interview and find out, when is the leakage happening? How much leakage is occurring? How often is it occurring? Are you waking up in the middle of the night and having wetting the bed or having a hard time getting to the bathroom? So basically, the history is going to give us where to direct the next studies or tests, or to start thinking about treatment. And so then typically in the office, then I would do a pelvic exam, and just like the gynecologist, you have an exam where we look inside the vagina and we basically measure where things are located and see if the bladder's in the right place, the urethra, the tube you pee through, if that's like moving, then it shouldn't be in someone doesn't have incontinence. I'll also do a test with someone standing up, and when they're standing up, I'll put a finger or two in the vagina and make sure the bladder is not drooping, because a lot of times when patients are examined laying down, because that's, unfortunately, I have patients come to me and they say, well, how come my gynecologist didn't see this? I said, well, if you didn't mention that was a problem, they wouldn't necessarily be looking for it and testing for it. And so when you lay down, all your organs kind of go back up where they're supposed to be. When you stand up, we get the full effects of gravity, and things start drooping and dropping, and then I can really tell where things are and if there's, if they're out of place. And then what I do a little bit differently too is I'll even take a look at people's low backs and their sacrums, because as a trained osteopathic physician, we're trained to kind of look at the whole body as a unit, and that not just where the symptoms are. And sometimes I'll find someone's sacrum is out of alignment, and that if the sacrum is out of alignment, that can affect the nerves that are going into the pelvis and lead to urge incontinence, where they have to run to get to the bathroom. And then we usually then sit down and kind of discuss those findings and basically what the initial options are. And then there's always a couple other tests that can be performed. There's something called a cystoscopy, where they can be done in the office or in a surgery center. It's basically using a small camera to look into the bladder to make sure there's nothing inside the bladder. And that's really important for people with urge incontinence. When patients have the urge and they got to run to get there, one of the things you don't want to ignore is, oh, this is just a normal part of aging, because it can be an early sign of something more serious. If you have a bladder cancer that's growing in the bladder and irritating the lining of the bladder, that could be causing these urge symptoms. Bladder stones can be doing this. Bladder infection, a chronic infection that has gotten deeper into the tissue that doesn't give you those traditional symptoms of like burning, can sometimes show up as just urgency and frequency. So evaluating the lining of the bladder is important. And then there's another test called urodynamics, where we take a very, very small, it doesn't sound comfortable, but I've been through it myself. You can survive it.
It's not that bad.
No, it's not that bad. You take a very small tube with little pressure sensors on it, and one goes in the bladder, one goes in the vagina, and we fill you up drop by drop to see how the bladder is actually functioning. So it's almost like an EKG for the bladder. It maps out the functioning of it. So though it's not the most natural test, it's what the closest thing we have to seeing what your bladder is doing as you're filling up with fluid. And so if you're a person with urge incontinence, what we might see is that the bladder gets filled to a certain point, and then all of a sudden the bladder just contracts and just pushes it out without you knowing it. And we can see that either by you will leak when we're doing this test, or we will see the spasms on the computer. Or if you're a person that has stress incontinence, when you cough, we'll see a drop in the pressure of the urethra, the tube you pee through, because that's a sign that through either childbirth or heavy lifting, that you may have had damage to the ligaments or the support underneath that tube. And so instead of those ligaments holding things in place, when someone coughs, laughs, sneezes, the whole tube kind of drops and opens up. Instead of those ligaments were in place, they would kind of put pressure on that tube when you're jumping, coughing, laughing, and would help close it. So there's a bunch of different testing. And then you get into what the treatment options are.
Right.
So,
but let's just talk about the testing for now.
Sure.
So I want everybody to understand urge incontinence means when you have the urge, you leak, and stress is physical stress. So like Dr. Greenleaf was saying, it's not emotional stress. It's not that when you get upset, you have leakage. It's physical stress, so jump up and down, and that neck support of the bladder holds it up. That can be broken with childbirth and other problems. And I don't want everyone to get worried, oh my gosh, I have bladder cancer, because incontinence is extremely common and bladder cancer is extremely uncommon. Do you have any stats on those for everybody listening?
The one stat that I can tell you specifically is sometimes people are sent to my office because of blood in the urine. And that sometimes can be that we look at more as an early potential warning sign of bladder cancer. But I will tell you, 90% of the time with people with blood in the urine, it's not. 10% of the time it is. So I would probably put those kind of stats on the urgency to it, even urge incontinence even less so. I'd say probably like 95% of the time it's not cancer. So
Okay. So let's talk though about some of the issues that can predispose you for urge incontinence. I know when I practiced office OBGYN, urge incontinence was extremely common. And the number one question that I would ask that pretty much the answer would determine what the cause was, and I would have the solution was, do you drink diet soda?
Yes. Yeah.
And particularly, do you drink caffeinated diet soda? Dr. Pepper seems to be a particular offender. And if the answer was yes, I'd say, well, just stop drinking it and your urge incontinence will go away. And invariably, people would come back and say, it's a miracle. I stopped drinking Dr. Pepper. My urge incontinence went away. So let's talk about that. Why is that?
So there are certain foods that, because of the pH, the acidity level of them, they can actually cause irritation to the bladder. So, just anything that you're eating and absorbing into your body, your body's going to process it. Your kidneys are going to start filtering things. And now that urine's going to end up in the bladder. And, there are little chemicals that can be passed through into the urine that are very irritating. Coffee anything caffeinated usually tends to be very irritating to the bladder. So coffee, tea, carbonated drinks, even if they're not have caffeine in it, but if they have caffeine, even worse. Foods that are very acidic, so your citrus fruits. You get somebody who thinks that they're, following that picture of that nice breakfast, that you'd see in the magazines with your coffee and your orange juice. And, next thing you know, they're telling you, oh, I pee like 10 times before noon and I'm running to the bathroom. Well, you're drinking eating very acidic things. Chocolate can actually be irritating to the bladder. All the good things, chocolate, wine, red wines in particular, alcohol in general, but the red wines in particular, tomatoes. So yeah, you're going to have that nice Italian dinner with your tomato sauce and your red wine. If you have an urge incontinence issue, then that may be more irritating. But it's, not to say that everybody eating those foods are going to have that problem. It's just those tend to be very irritating to the bladder. If you're a smoker, nicotine, a lot of people think, well, you don't have to tell people nowadays that smoking's bad for their health. They know it. I don't give people, lectures about that, but I do like to remind them that there are nicotine receptors in the bladder. So, not only can that nicotine irritate the bladder, but it's actually one of the causes of bladder cancer. So,
the bladder has this lining inside of it, kind of like your stomach, because it has a very low acid pH, has a gag layer to protect it, so it won't your stomach juices won't digest the stomach wall. Your bladder has a layer to protect it also, and a lot of chemicals will be irritating and can disrupt this layer. And the aspartame in the diet drinks is particularly offensive to the bladder, and there are actually more complaints to the FDA about aspartame than any substance known, whether it's a food additive or a pharmaceutical, and it has been shown to cause cancer in rats. And I find that that's particularly offensive. And then the Dr. Pepper, because of the bicarb, that's an irritant. The caffeine's an irritant. The aspartame's an irritant. But like Dr. Greenleaf is saying, there's usually a compound effect. It's usually not just one thing that you're consuming that's causing the bladder irritation, the frequency, the urgency, and the incontinence. Usually it's several, and it's a lot of these acid producing foods. So one of the things that you could do is look at your diet and see, ooh, what am I consuming? If you're smoking, you got to stop now. We don't even need to talk about that. But the foods that you're consuming that are very acidic and could be irritating to your bladder, removing those from your diet. And I would bet 80% of the time when people would change their diet, when they were my client, when I had an office-based OBGYN practice, the urgency and incontinence went away, hands down.
People panic because they go, oh my God, I can never eat any of the things I want ever again. And I'm like, that's not it. Just stop them for a couple weeks and see what happens. If you get better, add the foods back one at a time, like do one, wait a couple of days, see what happens. Do another one, wait a couple of days, and see if there's, see if you can identify the food that bothers you. The other thing when it comes to bladder irritation, there are some simple remedies. There's an over-the-counter product called Greenleaf, which is basically a bladder antacid. So some people are, they want that coffee and they'll take some Greenleaf, and then that'll help neutralize the acid in the coffee. I had another patient tell me that she found something recently on Amazon called Coffee Tamer, and it was some kind of, it was just like a bicarbonate type of solution that or powder that you put in your coffee to neutralize the acid, and that was working for her. Or you can even just take baking soda and water. Now, I personally have tried it myself. I can't tolerate the taste, but I have patients that swear by it, especially if they're a patient that actually experiences burning in their bladder from eating these things. I'll say just take like a quarter of a teaspoon in a little thing, or up to a teaspoon in 8 ounces of water, and drink that, and that will help neutralize the acid in the urine too.
Yeah,
I wouldn't do that more than twice a day though, because you don't want to throw your acid base balance off too much. But yeah, that's a simple, easy, cheap way to do it.
That's a great remedy for food sensitivities too, that a lot of people listening may not be aware of. If you're sensitive to a certain food and you get a reaction, you can take baking soda. So baking soda has a lot of great purposes. So looking at your diet is one of the things that you can do to reduce urgency and urge incontinence. What are some other situations that predispose women to having urgency and urge incontinence?
One of the things in general is, unfortunately, as we go through perimenopause and menopause, that can add to both types of incontinence. But we will see it with urge incontinence. It's just the thinning of the line. When you go through perimenopause and menopause, your estrogen level starts to decline, and as that happens, you get a thinning of the vaginal tissue. And with that thinning of the vaginal tissue, you get a change in the pH of the vagina. So the vagina is the one place in your body you want it to be acidic. And as you're going through menopause, it starts becoming a little bit more basic. And this is a long explanation for a simple answer. But then with that change, what happens is, so they think that the thinning of the tissue can also can add to urinary irritation. That thinning of the tissue takes away some of that support that can add to stress incontinence. But with urge incontinence, what will happen with that change in pH, you lose your healthy bacteria in the vagina. When you lose your healthy bacteria in the vagina, other bacteria will start coming in there and start taking over. And I think it's that presence of this other bacteria that is now starting to irritate the lower urinary tract, that urethra, the tube you pee through, and that can start adding to urgency and frequency. So
right. And there are also sex hormone receptors in that lower portion of the bladder and urethra themselves. So when your sex hormones start changing, which usually happens by the time you're about 40, you start having a gradual decline, then you're not getting the proper stimulation and support for health of that tissue in addition to the vagina. So getting your hormones naturally balanced, because it could also be the progesterone, and 50% of women will have a testosterone deficiency. And there are receptors for testosterone in those areas also. So that's key to getting the urge incontinence under control. And you touched on the vaginal acidity. So let's talk about that, because there are also probably some people listening who have problems with recurrent vaginitis. I know.
Oh, sure.
Yeah, I would see clients all the time with BV and yeast and tricks sometimes, and all kinds of problems. So why don't we touch on that? What's going on there?
So, I almost look at the vagina and the microbiome of the vagina as almost the core to a lot of what I do with, incontinence and recurrent urinary tract infection and recurrent vaginitis. So when you're younger and you have all your hormones, the pH of the vagina should be between 3.5 to 4.5. That's a nice healthy range. You have bacteria that normally lives there that are usually in what's called the lactobacillus species. So a lot of people have heard of acidophilus. Well, it's lactobacillus acidophilus. And there are a couple other ones that are in the lactobacillus species that are very predominant, that they help keep the vagina healthy. And so why they're there is, as when your vagina is healthy and you have your hormones, your tissue's nice and thick. Because it's thick, it'll be sloughing off old cells all the time, and new cells will be growing. Those sloughed off cells contain something called glycogen, which feeds the healthy bacteria. So the healthy bacteria likes that glycogen. And so the healthy bacteria keeps away the bad bacteria that can cause vaginitis and urinary tract infections by producing hydrogen peroxide. So they keep their environment very acidic with the hydrogen peroxide, and they're able to chase away everything else. What happens is, I mean, even in younger women, birth control can throw off the hormone balance and the pH balance, and I'll see recurrent vaginitis and urinary tract infections in those women because their pH of the vagina is off. They've lost their lactobacillus, their healthy bacteria. You see it in postmenopausal women and menopausal women because of that thinning of the tissue, and now that their bacteria doesn't have a food source and they lose it. But I think a lot of it too is diet related, in that as Americans, we don't eat a lot of fermented foods. So we're not replenishing our source of healthy bacteria in our bodies. So, you know, there's so many choices of fermented foods out there. It's, you know, you go to any of these stores and there's such a big market with the kombucha, which is the fermented teas, and the different types of yogurts, and you know, I've seen fermented sauerkrauts and cabbage and kimchi, and you know, getting more healthy bacteria into our body because of the fact that that bacteria probably got there to begin with, because of the fact that you have the vagina and the rectum is so close together that there can be a kind of crossover of that bacteria. And we know that that's how people get urinary tract infections, is because a lot of the gut bacteria is getting into the vagina, setting up home, and then getting into the urinary tract. So I think, you know, your gut health is very important to your vaginal health. Yeah. So, you know, even looking for even probiotics and supplements that support women's health.
Yeah, I think we should call it the veggie biome.
Yeah. Yeah.
So the care and feeding of your veggie biome,
yes.
you need to take care of it. You have to have the right acid-base balance, the right acidity, and you also have to have the right bacteria and the right hormonal levels. So to me, I think those are really the three keys to keep that vagina healthy. And I would see women just swing back and forth, a yeast infection, BV. And really you have to kind of say, stop, and what are all the factors contributing to these recurrent vaginitis problems, and get rid of them so that the body can come to homeostasis, which it wants to.
Yeah.
It really does want to.
Yeah, because the body always wants to heal itself.
It does.
No matter what we do to it.
We just need to get out of the way.
Yeah.
Do that. Yeah. So back to the urinary incontinence. So we talked about urge incontinence really being a lot and a big part of also a hormonal or chemical irritation type of problem. Infection also can do that.
Oh,
so
sure.
Chronic infection, if you have chronic bacteriuria, which is bacteria in your urine, but you don't have an actual infection, the body's not mounting an immune response, but that's something that can do it. And then these factors also can contribute to stress incontinence, right?
Sure. So, you know, with the stress incontinence, that all these things we've talked to about can add to that. But with stress incontinence, it's more specifically a lack of support under the tube that you pee through. So, and those ligaments can be damaged most commonly through childbirth. but they can also be damaged through someone who's lifted heavy objects. So if you're lifting a heavy object, what I tell people is, you see those big weightlifters on TV, they're not holding their breath, they're blowing out. Because if you lift something heavy and you hold your breath, that pressure's got to go someplace. And unfortunately, gravity is, your pelvis is just a big open hole to gravity, and so that pressure is just going to go straight to your pelvic floor, and you can damage those ligaments. People with chronic asthma or chronic bronchitis and chronic coughing, same thing. If you're coughing and that you can't help, but that can actually damage those tissues. So I've seen people I've had a couple patients who've never had children, but they've lifted something heavy, or they've had some really bad case of bronchitis and ended up with incontinence just because they damaged those ligaments. The unfortunate thing is, in traditional medicine, there is no way to repair those ligaments. Once they're torn or stretched, that's it. But the treatment options for stress incontinence are we're starting to enter a really exciting age because there's new options coming out all the time. One of the easy things people can do for this would help not only with stress incontinence but urge incontinence is your Kegel exercises. And everyone talks about the Kegels, but I think the problem with the Kegels is that everyone thinks they know how to do it, and I would say about 80% of people don't know how to do it. And
so help us know the truth.
Yeah.
How to do
it. I guess in words, the explanation always is the muscles that you're using to stop your urine flow when you're on the toilet. So, but I have patients who think that when they're peeing, they're supposed to be stopping their flow, and that's the exercise. No, those are we just tell you, like, if you're peeing and you try to stop it, those are the muscles. So that's only to recognize where those muscles are. You don't want to keep doing that while you're peeing. You want to try to recognize where those muscles are and then do it other times. I think, working with either a pelvic floor physical therapist, or even going to your gynecologist and have them show you how it's done. Meaning that if you have somebody that's actually monitoring and putting a finger or two in the vagina while you're trying to Kegel, and they can let you know, yeah, you're doing it, or no, you're not doing it. Because I have people who think they're doing it, and I'm like, they're tightening up every other muscle but
tilting their pelvis, maybe.
Yeah. Yeah. So, sometimes, doing that. I mean, if you want, you can do it yourself. You can you reach down, put a finger or two in the vagina and see if you could tighten and squeeze around your fingers. And then those are the muscles that you need to use. Now, some people's muscles are so incredibly weak that they can't even tighten. And there are simple exercises you can do to strengthen the pelvic floor without having to do the Kegels. Just sitting in a chair and rolling up a towel, or getting like a ball and putting it between your legs when you're sitting with your knees, kind of just in a normal sitting position, and just squeeze together on that ball or rolled up towel. Those will strengthen your pelvic muscles. And that's something you could do easily. I tell people to try to start off with 10 a day, then, in a week, try increasing it to do 10 and then relax, and then do 10 more. So do 2 sets of 10 and then relax. And then you keep adding to that. And then maybe once you strengthen the pelvic muscles, then you could start trying to do the Kegels. Or, there's, some areas of the country, there are pelvic physical therapists. Some, there's not as many, but, working with a pelvic physical therapist is really good to strengthen those muscles.
Right. And then talk about the equipment that I know you have in your store, which I find that it's kind of hard for people. I used to tell them also, it's the same the muscles that you use to stop peeing.
Yeah.
But same thing. It's kind of this esoteric, am I doing it right? I don't really know what you're talking about. And so I find that with the biofeedback, like the pelvic floor therapists will do, where there actually is a meter that shows when you're contracting the right muscles. But I used to love the graded vaginal weights, or the Kegel sizers that people could purchase, or Benoit balls. So talk about using those. Where should someone start? Yeah,
so there's a number of different kind of weights on the market, so that something that you can put in the vagina that gives you the sensation that there's something there so you can squeeze against. Plus, because they come in different weighted sizes, you can work your muscles up. I mean, they say any muscle, if you don't use it, you lose it. And that's especially prevalent in the pelvic floor, because nobody thinks of using those muscles. We take them for granted when we're younger. They're just there. You don't realize it until you're starting to have a problem. And then it's like, well, now what do I do? There's also a really interesting product called the Peri-Coach. It's this little device that's probably about that big, and it goes it's probably like the length of your thumb, and it goes into the vagina, and it attaches it Bluetooth connects to an app, and you can actually see your progress and see how you get the feedback of how you're tightening. And the nice thing with that program is your physician or clinician can actually access your information through an account, and they can track how well you're doing also. There are a couple other what are called periometers that are out there on the market, and they're just basically probes that can be placed in the vagina that attach to a little digital screen where you can see the numbers, so you're getting feedback that you're doing it correctly. And then one of the interesting, there's another some interesting treatments that have come out. There's a product called the Emsala, which I describe it as a pelvic magnetic chair, and you sit on it fully clothed, and it uses like an MRI machine magnet, very strong magnet, and when the magnet turns on, it causes your muscles to contract. So it actually does your Kegel exercises for you at 80 times what you're able to do yourself. So it might be a really good starting, I think when it comes down to it, anything you can do yourself is going to work better. I can't go make somebody work out for me. If I could, I would, because that would be awesome. But, I think that the Emsala is a really good product to start when your floor's completely weak and you just don't have any muscle mass to just build that up, and then start learning how to do your Kegels, and then, or even just, do the weights and the Kegels, or your little push your legs together, and it's something you want to do lifelong. You don't want to just do it and then, okay, I'm done, I'm good. It's, you want to keep exercising those muscles.
Yeah. And once you learn how to do it, you can make it a habit and tie it to something else. Like every morning when you get in your car to drive to work, that's your cue. You do your Kegels while you're driving.
Yeah.
And if you didn't have enough incentive to do them because it's going to help you not leak urine, it oftentimes leads to better sex, because you're strengthening the muscles that also surround the vagina, and that's a sort of tightening. And so it can lead to better sexual relations for you and your partner as well.
And also with orgasm, you get a spasming of those muscles, and if those muscles are better in shape, people have reported better orgasms. They can hold on to their orgasms longer. So there's many benefits to doing those exercises and strengthening the pelvic floor. Sure.
Great.
Yeah.
And then if these preliminary DIY tools don't work, what comes next for these types of incontinence problems? Yeah,
well, for the urge incontinence, other than, diet and exercise, then you're starting getting into what are your next steps. And in traditional medicine, the next step is usually medication. And there are about 8 different medicines on the market. About probably 7 of them prevent bladder spasms, and there's 1 on the market that actually relaxes the bladder. Now there is an there are actually 2 over-the-counter products that can be helpful, and people can try them. One is a medicine. It used to be, it's still called Oxytrol, but it used to be a prescription, and that's a patch that some people can wear. But I find that the problem with that being over the counter is people think, well, if one works, then more will work. And I had a lady once come in with like 5 of these patches on their body, and I would recommend more does not work. Actually, I was actually surprised when that medicine became an over-the-counter medicine, because of the fact that the way that medication works, it can, you can become dehydrated. You can get overheated when you're on it. It can cause confusion. It can cross into the brain and make people confused. So, if you're going to try it, just do it the way the package says. Don't put 5 because you can have more health problems. But there is pumpkin seed extract. They found that pumpkin seed extract can actually help. So there's some products out there on the market for that.
There's some holistic products out there
that
have pumpkin seed extract.
Pumpkin seed extract, yeah.
Great. Yeah,
So.
and I would just want everyone listening to know that we are trained, we are conditioned in this country to seek a drug when we have a medical problem. That's what we're taught, and so that's what we continue to do the rest of our lives. But dis-ease, lack of ease in the body, is not a sign that you need a drug. It's a sign that your body is telling you it's not happy. Your job is to figure out why, and really looking at the root causes of why it's not happy is what I'm encouraging you to do, and why I have this podcast in the first place, because you can go to your doctor and take this drug, because that's exactly what they'll do. Oh, you have urgent incontinence. Maybe some of them will talk to you about your diet, but most of them are just going to give you a prescription.
Yeah.
And what I want to encourage you to do is educate yourself about your body and what are the root causes of dysfunction. And I always have my pyramid of success, and at the foundation is hormonal balance. The next is toxicity, and that includes those chemical irritants we talked about and infectious agents. And then nutritional deficiency is the next, and then mental, emotional, spiritual balance. And one of the things that I always like to talk to my patients about who have urinary problems is, what are you pissed off about?
Yeah.
Because when you've got bladder problems, you're typically pissed off about something. And like that leaking of urine, if you think about it, is almost like frustration and anger coming out. And where are you getting frustrated and angry in your life? What's really ticking you off? And so part of healing it is looking at what's causing the inflammation to cause the muscle, because your bladder is just a big old muscle, to be hyperreactive. But what's causing you to be hyperreactive? So looking at these things. And like I said, you can go to your doctor and get any of these prescriptions. So we're not going to cover the drugs.
Yeah. Yeah.
We're about educating you about your body so you can make better choices, because as Dr. Greenleaf said, these medications have side effects. Every drug has a side effect. Every drug is a toxin that you're introducing into your body. So it's almost like you just go take some pesticides and, let me just eat that. Your body has to get rid of that. Let me just take these drugs. And I know we don't see it that way because we're conditioned not to. And I get on my soapbox, but that's why we're doing this podcast, is to educate you about this. So,
I think then another thing to look at with urgent incontinence is your spine in alignment?
Yes.
Because if your spine is not in alignment, and a lot of us aren't because we're sitting in chairs all day long, and that's going to pull and push on nerves, and that can affect the pelvic floor. I as an osteopathic physician, I have to admit, though, I don't do a lot of manipulation, but I do a lot of examination, and I find that majority of people that have urgent incontinence, their sacrum's out of alignment. And go to a chiropractor, go to a osteopathic physician that does manipulation. There's also simple exercises and stretches to rebalance your body. There's a book in particular that I like called Pain Free by Peter Egoscue. Mm-hmm. And he is a physiologist who came up with this book on how to keep your, just simple stretches and exercises to keep your body in alignment. And if your body's in alignment, it's more likely to function better. So I think that tends to be a very common cause of urgent incontinence too, is when these, these bones and nerves are getting irritated from being out of alignment. Mm-hmm. So.
Yeah, those nerves can get tweaked, and with pregnancy and childbirth, I know when I was pregnant with my second child, I had horrible sciatica. I could at the end, I was wheeling around my residency in a wheelchair because I just couldn't walk, and it really, those nerves get pressed on, and I even had dysfunction after I had the baby. And
Sure.
you think of this huge object coming through, and it really can cause damage to nerves and soft tissue, and so that could be a huge contributing factor as well. And osteopathic adjustment, or also called chiropractic adjustment, can be very helpful. So these are all great tools. I'm just wondering how you got interested in women's health and pelvic floor issues.
It's funny because people go, a lot of my patients are like, how did you decide to look at this all day long? And I'm sure you have got the questions with the OBGYN. I went to medical school and didn't know exactly what I wanted to do. I liked medicine, and I kind of went through all my rotations and which ones I liked, which ones I didn't like. And I found myself drawn to the surgical aspect of it. But then I actually started out in general surgery. And what I didn't like about general surgery, and not to insult the general surgeons, but they're kind of body mechanics. Like, I wanted to have more of a relationship with my patients.
Mm-hmm.
So I'd be the one on my general surgery rotations that was talking to people. So how are you feeling now that your gallbladder's out? Like, that really wasn't very good. So then I was like, then I ended up in OBGYN. And my problem with OBGYN was I like to sleep at night. And, babies come at all, and I couldn't deal with being up. So, and urogynecology was my very last rotation that I did as a resident. And I went, wait a minute, this is what I like. This is really interesting. So, I had years ago, I had asked when I was a student, like, I just want to do the surgery part. I just want to do the gynecology part. And they told me, no, it doesn't exist. It doesn't exist. And so then I kind of just found my place. So, and just,
great.
It's a very interesting field. Unfortunately, there's not that many of us. There's only about 1,500 urogynecologists in the country. So, but it is a growing field, and it's definitely one that's needed. So.
Yes, it sure is. And I'm excited for your store. I'm going to let you tell everyone how they can find out more about you and what kind of things you have, like your pelvic floor store.
Yeah, so the pelvic floor store is www.pelvicfloorstore.com. Basically, what I found was I started recommending products to my patients, and the problem was that they weren't easy to find. Mm-hmm. And a lot of these companies will not sell on Amazon. And so I decided, well, let me just start a store and have everything in one place so people can try to get it in one place. So check it out. It's definitely, I'm adding things to it every day because this store is really for the patients. So if there's a product on there that I think is good, but the patients are like, no, I don't like this, let me know because I'll take it off. Or there's something that you come across and you want on there, I will put it on. So I'm always searching for new pelvic products, and I have a lot more to put on there than there. We're starting in steps. So
great.
Yep.
And then your website, Dr. Betsy Greenleaf. So DR, correct?
Yep.
BetsyGreenleaf.com. And we'll put these in the show notes too, so people can find them. Thank you so much for sharing your wisdom. If someone's suffering with incontinence, I always like to leave everyone with the top 3 take action steps that they can do today that are simple, actionable tips. What would be the top 3 take action tips you would give them if they're suffering with incontinence?
I would say number 1, just don't be hard on yourself. This is not something that you did. It's very common. So just accept it and then take the actions to go find the help that you need. Number 2, I would include both diet and exercises. Take a look at your diet. Take a look at doing the exercises, because those are 2 simple things that you can do for yourself. And number 3, if it's affecting your quality of life, if it's really making you unhappy, then go seek the help. If you're leaking, I tell patients all the time, if you're leaking and it's not affecting your quality of life, it doesn't bother you, then you don't need to do anything about it, because there'll be people out there who will try to talk you into treatments that you don't necessarily need if you don't feel that they're good for you. So if it affects your quality of life, then go for it. But if not, then just keep doing what you're doing.
Right. Well, good advice, and know you're in good company if it's happening to you. And there are solutions, simple, natural solutions that you can start working on today. Thank you so much, Dr. Betsy, for joining us today. Really appreciate the work you're doing and the information that you've shared. Thank you so much.
Thank you so much for having me.
Thank you for joining me for this episode of Her Brilliant Health Radio. Hopefully you're inspired to take action on some new information you received today. A step towards the bountiful, blissful, beautiful vitality that you deserve. If you have health topics and questions you'd like addressed, please message me on my Facebook page or visit KyrinDunstonMD.com and let me know. I'd love to help. Remember to share this podcast on social media and send it to your friends and family who could benefit from it too. If you love the show, please go right now to iTunes, write a review, and make sure to subscribe to the podcast so you'll be the first to know when future episodes are available. Thank you again for joining me, and remember, achieving optimal health isn't magic, it's science.